Thank you, Marianne, for this introduction. Today, my topic is cancer prevention and the emerging role of digital therapeutics. So in this presentation, I will first discuss the topic of cancer and the importance of prevention. And after that, I will discuss what are the digital therapeutics and how they can be applied to prevention. So I am a medical doctor and I am part of the personal health data science team under the supervision of Dr. José Sousa. And this is our team. So what is cancer? Cancer is a common disease. It seems that almost everyone knows someone who has been affected by cancer. Worldwide, cancer is the second leading cause of death after cardiovascular disease. In 2020, 19.3 million new cases of cancer were diagnosed and 9.9 million deaths were noted due to cancer. The most common cancers in men in 2020 were malignant neoplasm of the lung with a share of almost 14.3%, and prostate cancer with a share of 14.1%. In women, the most common cancers were the breast and the lung. According to the International Agency for the Research on Cancer forecasts, by 2040, there will be an increase in the number of new cancer cases compared to 2020 by approximately 9.6 million, and in the number of deaths by approximately 6.2 million. As shown in the table here, the largest increase in the number of new cancer cases is expected to occur in Africa, as well as in Latin America and the Caribbean. The economic impact of cancer is significant and is constantly increasing. Therefore, due to the increasing number of cancer cases and deaths from year to year, prevention, and especially primary prevention, should be the dominant way of trying to solve this problem. According to the WHO, it is possible to avoid cancer by 30% to 50% as a result of conscious care of the health of the population, which is focused on changing lifestyle habits and environmental pressures. This can be accomplished by avoiding risk factors and implementing existing evidence-based prevention strategies. The cancer burden can also be reduced through early detection of cancer and management of patients who develop cancer. Many cancers have a high chance of cure if diagnosed early and treated adequately. Cancer can be defined as disease consisting of undesirable development of cell growing and multiplying uncontrollably in a person's body. The process of carcinogenesis is a long-term and complex multi-stage process which takes place at the level of cell DNA. Cancer can be termed a disease of the cells. Cells are the body's basic building blocks, and they make up tissues and organs. The body constantly makes new cells to help us grow, replace worn-out tissue, and heal injuries. Normally, cells multiply and die in an orderly way so that each new cell replaces one lost. Sometimes, however, cells become abnormal and keep growing. In solid cancers, such as breast cancer, the abnormal cells form a mass or lump called a tumor. In some cancers, such as leukemia, the abnormal cells build up in the blood. Tumors can be benign or malignant. Benign tumors tend to grow slowly and usually don't move into other parts of the body or turn into cancer. Cancerous tumor, on the other hand, also known as malignant tumors, have the potential to spread, and this makes them very dangerous. The fact is that if we can avoid the carcinogens which can trigger cancer cell growth, we strongly increase our chances of never developing this disease. And so what is prevention? Cancer prevention is action taken to lower the chance of getting cancer. This can be accomplished by avoiding carcinogens or pursuing lifestyle or dietary practices that modify cancer-causing factors. The concept of prevention is based on a division of activities: primary prevention, secondary prevention, tertiary prevention, and quaternary prevention. Primary prevention deals with disease prevention activities in people without symptoms of the disease. Secondary prevention involves the detection of the disease at an early stage in people who feel well. Tertiary prevention includes activities concerning the sick and are aimed at reducing the negative consequences of the disease. Finally, quaternary prevention activities are concentrated on the protection of individuals from medical interventions that are likely to cause more harm than good, and focus on reducing overdiagnosis, overtreatment, and iatrogenic harm. The development of effective prevention programs should be based on the knowledge of risk factors and mechanism for weakening these risk factors or compensating for them. Most cases of cancer are caused by somatic mutations formed in a given tissue as a result of exposure of the body to environmental factors, or a consequence of accidental genetic changes during DNA replication. Anything that increases your chances of developing cancer is called a cancer risk factor. Anything that decreases a chance of developing cancer is called a cancer protective factor. The International Agency for Research on Cancer regularly publishes and updates environmental factors that are carcinogenic, hazards to humans. And this includes chemicals, complex mixtures, occupational exposures, physical agents, biological agents, and lifestyle factors. Although hereditary factors influence the development of cancer, they contribute to only 5 to 10% of cancer cases. Generally, risk factors can be divided into modifiable and into not modifiable risk factors. Modifiable risk factors are those that can be modified or avoided by our actions, and not modifiable are those that we don't have control over. For example, age and gender. In this presentation, I will focus mainly on describing the modifiable risk factors since they have the greatest potential for change. Tobacco use is the leading cause of cancer. Other risk factors that can be avoided or modified are lifestyle factors, such as overweight or obesity, unhealthy diet, physical inactivity, alcohol abuse, infections with carcinogenic viruses or bacteria. In addition, the development of cancer is also triggered by environmental factors, for instance, UV radiation, ionizing radiation, air, water, soil pollution, occupational factors, exposure to, for instance, exposure to asbestos or heavy metals, and biological or internal factors. It is important to note, however, that even if the substance has been designated as a carcinogen, it does not mean that the substance will necessarily cause cancer, since many factors influence whether a person exposed to carcinogen will develop cancer. These include the amount and duration of the exposure and the individual's genetic background. Here you can see selected cancer risk factors and associated cancers. As you can see here, quite a few of these cancers can be related to different risk factors. Many times it is very hard to pinpoint one single factor for developing the disease, as the disease may be also transversal to other risk factors. For example, liver cancer can be traced back to having risk factors such as diabetes, alcohol, tobacco use, overweight and obesity, or immunosuppression. Tobacco use is the single largest modifiable risk factor, implicated in around 30% of all cancer-related deaths. Reduction of active and passive exposure to tobacco smoke is an essential step in the primary prevention of cancer. Evidence proves that cigarette smoking increases the risk of at least 12 cancers. Smoking is also the main cause of lung cancer. Not smoking or quitting smoking lowers the risk of getting cancer and dying from cancer, and exposure to nicotine leads to addiction in many tobacco users. Passive smoking is another problem and is an established cause of lung cancer. Passive smoking or second-hand smoking is what you inhale accidentally when you are near the source of tobacco smoke. You may not feel any change, but breathing second-hand smoke can affect your health. Studies show also that the smoke from the glowing tip of the cigarette is 4 times more harmful than that inhaled by the smoker. Third-hand smoke is yet another problem. Third-hand smoke is the residue that stick to carpets or walls and other surfaces after the smoke clears, and is believed that this residue can harm your body just like smoking, and second-hand smoke can. Obesity is another significant modifiable risk factor for developing cancer. Excess body weight not only increases the risk of several cancers, but also contributes to the development of different cancer risk factors, such as non-alcoholic fatty liver disease and type 2 diabetes. Raised BMI is also a major risk factor for several cancers. Evidence suggests that up to 20% of cancers could be related to weight gain, and obesity. Furthermore, evidence suggests that inflammation may be a fundamental and reversible mechanism through which obesity promotes cancer risk and progression. Therefore, weight loss may represent an effective strategy for cancer prevention and control. Over the past decade, many epidemiological studies have confirmed the importance of proper diet in preventing and controlling the incidence of cancer. The biological mechanisms underlying the association between different dietary patterns and cancer risk are likely due to the biological effects of various dietary components. Several interrelated biological mechanisms have been proposed, including the gut microbiota and their metabolites, epigenetics, inflammation and immune function, metabolic and hormonal disruption, oxidative stress, oxidative damage. And accumulating evidence suggests that diet can modulate these mechanisms. When it comes to anti-cancer diet recommendations, there are different approaches. However, a European Code Against Cancer, coordinated by the International Agency for Research on Cancer, recommends diet characterized by a high intake of plant foods, such as fruits, vegetables, pulses, and whole grain foods, and low intake of red and processed meats. It is also advised to limit high-calorie foods, so foods high in sugar and fat, and avoid sugary drinks and consumption of fast foods and other processed food. Aflatoxin and nitrosamines are established carcinogens which can be found in food. Aflatoxins are associated with liver cancer, while nitrosamines have been associated with gastric cancer and esophageal cancer. Several studies show that intermittent fasting and periodic fasting may reduce tumor incidence both by delaying aging and preventing DNA damage, and immunosenescence by killing damaged precancers and cancer cells. The time restriction of nutrients may delay the incidence of age-related diseases, and prolonged lifespan through its strong effects on hormone levels and growth factors. Several studies also show that the lifestyle modifications with an intermittent fasting protocol and proper diet may help lower blood glucose levels, maintain the BMI, and reduce inflammation. Periodic fasting may also have anti-cancer effects by reducing tumor progression, enhancing death of cancer cells, and elevating the effectiveness and tolerability of chemo and radiotherapies. Several studies also show that certain food compounds and nutrients may have proven roles in cancer prevention. For example, omega-3 fatty acids found in fatty fish, or dietary polyphenols found in certain plant foods, such as fruits and vegetables, herbs, spices, or tea, have proven to take part in prevention of several cancers. There is causal association between alcohol consumption and an increased risk of developing cancer. The consumption of alcohol increases the risk of several cancers. The 2020 American Cancer Society Guidelines for Diet and Physical Activity for Cancer Prevention recommends that it's best not to drink alcohol. However, people who do choose to drink alcohol are suggested to limit their consumption to no more than 1 drink per day for women and 2 drinks per day for men. It is also established that there is a joint effect of tobacco smoking and consumption of alcoholic beverages on the risk of developing cancer of the oral cavity and pharynx, with a very high risk observed in individuals who are both heavy drinkers and heavy smokers. There is strong evidence that physical activity is an important preventing factor for cancer development. Physical activity has an effect on several body systems, including endocrinologic, immunologic, metabolic processes, which can affect the risk for the development of several cancers. Evidence shows that physical activity can influence the risk of cancer development through different biological mechanisms. These include a likely effect of physical activity on insulin resistance, body composition, sex steroids hormones, and a possible effect on vitamin D, adipokines, inflammation, and immune function. Physical activity also increases gastrointestinal transit time, which leads to less interaction between colon mucosa and carcinogens contained in the food. Furthermore, evidence shows that physical activity also reduces cancer mortality and recurrence in cancer survivors. Convincing evidence exists for the beneficial effect of physical activity on the risk of developing colon cancer, probable evidence for an effect on breast cancer and endometrial cancers, and as well as possible evidence for an effect on cancers of the prostate, lung, and ovary. Additionally, for each additional 15 minutes of daily exercise beyond the minimum amount of 15 minutes a day, cancer mortality decreases by 1%. The WHO recommends adults to be active daily and to limit the amount of time spent being sedentary. According to the World Cancer Research Fund report, it is likely that the greater the amount of physical activity, the greater the benefit for the cancer prevention. Short breastfeeding is another cancer risk factor. Breastfeeding protects against breast cancer in mother and promotes healthy growth in the infant. Evidence on cancer and other diseases shows that sustained and exclusive breastfeeding is protective for the mother as well as the child. Lactation may protect the mother against breast cancer, and having been breastfed as a child may protect children against excess weight gain, overweight, and obesity. So those cancers for which weight gain, overweight, and obesity are a leading cause. Additionally, breastfeeding protects the development of the immature immune system and protects against infections in infancy and other childhood diseases. the WHO recommends that infants are exclusively breastfed for 6 months and then up to 2 years of age or beyond alongside appropriate complementary food. There is vast scientific evidence supporting that a variety of infectious agents play a causal role in the tumor development and proliferation. Here in the table, you can see the associations between different cancer-causing pathogens and different tumors. Here you can see the table with the 4 main cancer-causing pathogens and ways to prevent and eliminate the infection. It is crucial to reduce exposure to cancer-causing infections agents such as viruses, bacteria, fungi, and protozoa. Preventive action can consist of behavioral changes to limit the possibility of infection, as well as vaccinations and the diagnosis and treatment of infections. It has been widely documented that contamination of the natural and occupational environment can be one of the risk factors for developing cancer. It is difficult to avoid the contamination during individual life, but preventing measures can be used to some extent. Currently, there are 25 chemical agents or groups or mixtures in the area of occupational exposure that have been established as a human carcinogens, and other 25 as probable carcinogens. These include exposure to asbestos, silica, and heavy metals. It is estimated that between 4% and 5% of the cancer is developed in developed countries has been attributable to occupational exposures, with lung cancer being the most predominant. On the other hand, in developed countries, it is estimated that between 1% and 4% of cancer cases are attributable to environmental pollutants. And these include toxins in urban air, as well as in the air inside homes, and in drinking water due to fluorination products. Here you can see part of the table with different chemicals classified as human carcinogens, for which exposures are mostly occupational. As you can see, the list is vast and includes many agents responsible for cancer development. Ultraviolet radiation, also called as UVR, is a known carcinogen responsible for the development of most skin cancers cases. UVR can come from the sun as well as from UV emitting devices, for instance, tanning beds, and has been categorized by the International Agency for Research on Cancer as a Group 1 carcinogen. Recent studies also strongly suggest that radiation emitted by UV nail polish dryers, a commonly used accessory used in different manicure salons, is damaging to human cells and may cause cancer of the hand, and that UV nail polish dryers, similar to tanning beds, may increase the risk of early onset skin cancer. The best method to reduce exposure to ultraviolet radiation is to use broad-spectrum sunscreen with a sun protection factor of 15 or greater, wearing hats, sunglasses, sun protective clothing, avoid tanning bed use, seeking shade, or avoiding solar radiation during its peak activity hours, so between 10 a.m. and 4 p.m. A greater focus should also be placed on self-examination and early detection of skin changes in order to be aware of any new or changing skin spots or growths, particularly those that look unusual. Here on the left, you can see how the most common skin cancers may look like. So melanoma is the most serious form of cancer. On the right, you can see ABCDE melanoma rule. It is a set of characteristics you have to look for in a mole to consider it suspicious. We look at asymmetry, at border, color, diameter, and if it is evolving. It is established that ionizing radiation can cause cancer through direct DNA damage. Many studies have investigated the effects of ionizing radiation as a cause of hematological malignancies and solid cancers. Everyone is exposed to a range of natural and man-made sources of radiation to some extent throughout life. A large portion of the population has been exposed to low doses of ionizing radiation, either from diagnostic medical procedures, occupationally, or to naturally occurring radiation emitted from bedrock within the Earth crust, as well as to cosmic and solar radiation. When it comes to exposure to environmental ionizing radiation, the inhalation of naturally occurring radon is a major source of radiation in the population. Radon is a natural radioactive gas that is found in rock formation and is the second leading cause of lung cancer after smoking, with substantial epidemiological evidence suggesting that it may be the cause of approximately 1 in 10 lung cancers in Europe. The levels of radon in the home or building depend on a variety of factors. And therefore, it is recommended for the householders to test their homes for radon, where this is advised. And efforts to reduce high radon levels at home should be implemented. Medical exposure remains by far the largest man-made source of exposure to ionizing radiation, and it relates to diagnostic radiology, nuclear medicine, and radiotherapy. Medical radiation has become the second greatest source of exposure to radiation for European citizens after exposure to radon in homes. Due to the increased risk of cancer associated with the application of medical radiation, decision on whether to use it should always outweigh the potential risk. Hormonal imbalances can cause an increased risk of certain cancers, as hormones act as a potent regulators of bodily functions. This increased risk of developing cancer may be also associated with the use of natural or synthetic hormones for medical purposes, as in certain contraceptive preparations and in post-menopausal hormonal therapies. Evidence shows that long-term use of combined estrogen-progesterone hormone replacement therapy is associated with an increased risk of breast cancer. On the other hand, estrogen-only menopausal hormone therapy is known to induce endometrial hyperplasia and endometrial cancer, as well as ovarian cancer, and is used only in women who have had a hysterectomy. Hormonal contraceptives possess both cancer preventive and cancerogenic effects. The combined estrogen and progesterone oral contraceptives increase the risk of cancer of the breast, cervix, and liver, as well as reduced the risk of ovarian and endometrial cancer. Therefore, any decision to use oral contraceptives or menopausal hormone therapy should be based on a thorough evaluation of the risk-benefit profile of each individual woman. Irrespective of the drug type, long-term monitoring of the potential carcinogenic risk is imperative. Studies also have shown that being exposed for a long time to high levels of endogenous estrogen and progesterone made by ovaries has been linked to an increased risk of breast cancer in women. These increases in exposure can be caused by starting the menstruation early, going through menopause late, being older at first pregnancy, or never having given birth. Additionally, studies show that having given birth is a protective factor for breast cancer. Having had a full-term pregnancy reduces the risk of developing ovarian and endometrial cancers. Furthermore, the risk of these cancers decline with each additional full-term pregnancy. Inflammation is linked with the development of and malignant progression of most cancer. So targeting of inflammation could represent an attractive strategy both for cancer prevention and for cancer therapy. Many cancers emerge from the sites of infection and chronic inflammation. Evidence shows that up to 25% of cancer cases worldwide due to chronic infection and inflammation. Lifestyle modifications such as healthy diet, exercise, alcohol, and smoking cessation have proven effective in decreasing inflammation and reducing the risk of cancer-related deaths. Immunosuppressive medicines are used after an organ has been transplanted from one person to another. These medicines decrease the body's immune response to help keep the organ from being rejected. Immunosuppressive medicines are linked to an increased risk of cancer because they lower the body's ability to keep cancer from forming. The risk of cancer, especially cancer caused by a virus, is high in the first 6 months after organ transplant, but the risk lasts for many years. Therefore, very important is post-transplantation cancer screening, which needs to be tailored to each individual patient receiving immunosuppressive medicines. Chemoprevention entails the use of natural, synthetic, and biological chemical agents to reverse, suppress, or prevent malignant progression to invasive cancer. So far, a relatively small number of agents have been specifically approved for cancer chemoprevention, and these drugs are only indicated for the people at high risk of developing certain cancers. This higher risk may be because of family history or some precancerous condition. Several other drugs are under evaluation as preventive therapies against cancer, and these include aromatase inhibitors, aspirin, metformin, and statins. However, further studies are still necessary to warrant the consumption of these drugs for primary prevention of cancer by healthy individuals. The role of vitamin D in cancer prevention remains an area of research interest and debate, though it is widely recommended to avoid deficiency. Several studies show that vitamin D exhibits pro-apoptotic and anti-proliferative properties in relation to cancer. Accumulating results from several studies strongly suggest that vitamin D deficiency increases the risk of developing cancer, and that avoiding the deficiency and adding vitamin D supplements may be an economical and safe way to reduce cancer incidence and improve cancer prognosis. Probiotics may also play an important role in cancer prevention and support anti-cancer therapies by modulating intestinal microbiota and immune response. The results of many in vitro studies indicate beneficial properties of probiotics in modulating the proliferation and apoptosis of cancer cells, including, for instance, gastric, colonic, and myeloid leukemia cells. This may be in part because a gut microbiome imbalance can lead to pro-inflammatory immune responses and to the initiation of disease processes, including cancer. So the result of many clinical studies prove the potential effectiveness of probiotics in preventing, treating, and reducing the progression of several types of cancer. When we are talking about the probiotics and the gut, it's also important to mention the gut microbiota and its contribution to cancer development. The gut microbiota can modulate several physiological functions, such as metabolism, inflammation, and immunity, and therefore it has a key impact on the state of the health and the occurrence of various pathologies. Microbiome dysbiosis can lead to the development of cancer. Therefore, identifying the bacterial species involved and their mechanism of action may be beneficial in preventing the occurrence of cancer, because identified microbial species can serve as a tumor biomarkers. Preventing cancer by modifying the composition of the microbiome using various strategies, for instance, proper nutrition, choosing the right probiotics, prebiotics, or a combination of it, expands the different possibilities for cancer prevention. Digital therapeutics have been defined as an emerging class of medicines that deliver evidence-based therapeutic interventions based on scientific evidence obtained through confirmatory clinical investigation to prevent, manage, or treat a broad spectrum of physical, mental, and behavioral conditions. The goal of digital therapeutics is to support therapeutic decision-making based on evidence using software tools that allow for the prevention, management, and treatment of healthcare conditions. Digital therapeutics have the potential to transform the management of chronic diseases, including cancer, which represents the real health emergency. They may represent the first therapeutic option offered by each physician to each of their patients with chronic diseases. Digital therapeutics can provide a supplementary clinical treatment support to other already existing classic therapies. They may be used alone or in conjunction with drugs or other therapies to enhance and support medical treatment. They have the potential to improve outcomes, personalize care, reduce costs, and address unmet patient needs that traditional treatments and therapies have been unable to provide. They can often deliver treatment or intervention more cheaply than traditional therapy by reducing the demands on clinicians' time. They may be suited to become the first line of defense in the area of oncological diseases and other chronic diseases, as well may play a significant role in the prevention, diagnosis, and treatment of cancer or other chronic diseases. Here you can see definitions, characteristics, and product examples of digital health, digital medicine, and digital therapeutics. As you can see, digital health encompasses various platforms and systems that apply technological solutions to enhance healthcare delivery. Digital therapeutics is one such category of digital health solutions. You can see also the difference between digital health products, such as wellness apps, and digital therapeutics. Wellness apps are products like fitness and lifestyle apps that capture, transmit, and store health data, such as individuals' heart rate or daily step count. Wellness apps are not required to be clinically tested and cannot be used as a clinical intervention to treat a disease or disorder. Meanwhile, prescription digital therapeutics are medical interventions that use software to treat, manage, and prevent a disease or disorder. Digital therapeutics also incorporate patient privacy and security protections. They publish trial results with clinically meaningful outcomes in peer-reviewed journals and are cleared by the different regulatory bodies. One of the examples of digital therapeutics solutions used in oncology can be MoveCare, which is used for monitoring using a simple weekly questionnaire to detect relapse or complication during follow-up of lung cancer patients. Digital therapeutics is prescribed by the physician. Then patient reports the symptoms weekly via digital questionnaire. Then MoveCare algorithm analyzes the answers. If the anomaly is detected, an alert is sent to the medical team immediately for further investigation. The advantage which MoveCare gives over standard lung cancer follow-up is that caregivers are alerted the moment a problem is detected, instead of weeks or months after the event, when the CT imaging is scheduled, which has proven in the studies to increase survival. Olina is another example of prescription mobile app for cancer patients, designed to help them in the management of their symptoms and enable remote monitoring by physicians. The application was designed in such a way that the patient could self-report adverse events that occurred during clinical cancer treatment and receive daily symptom management recommendations by remote monitoring. The algorithms were built to provide direct, immediate feedback to patients in response to symptoms, including instruction for re-examination or dietary changes. Here you can see the overview of the worldwide regulatory status for selected digital therapeutics with their indication and main areas of intervention. Generally speaking, the mechanism of action of digital therapeutics used in oncology is mainly limited to cognitive behavioral stress management and the management of symptoms and possible adverse events of anti-cancer treatments. Here you can see a figure which shows a possible digital path where the integration of machine learning could substantially contribute to the use of digital therapeutics as a prevention tool. As I have shown, there is still lack of digital therapeutics intervention in the field of broadly understood prevention. And digital therapeutics interventions are focused mainly on cancer patient symptom management and improvement of their quality of life. Therefore, our further work on these topics will be devoted to developing the appropriate digital pathway of the patient at the stage of the first line of doctor-patient contact, with a strong emphasis on the importance of personalized preventive intervention. Because of the data that we have, for now we are focusing on cancer. But this model can be applied also to other chronic diseases. So first step is to identify patients most at risk. Many times we have a vast and incomplete data, and here AI can help to bring additional investigation to get a quicker and better assessment, enhance the decision-making process, and make stratification of patients. Then the assessment of applicable risk factors is done with the development of personalized prevention plan. Next, education and monitoring of the patient. Since patient education and knowledge about the patient's own capabilities and limitations seems to be crucial for planning an effective prevention strategy. And the last step is assessment of patient's goal attainment. So this work is part of digital health research effort of the team and is integrated with 2 other PhD students from Portugal working on liver and gastric cancer. During their PhD at the Faculty of Medicine at University of Porto, and having Jose as the principal supervisor. This work is also part of the review paper in progress with the title Moving Cancer Diagnosis Singularity to Prevention Through Digital Therapeutics, done in collaboration with Professor Mark Lawler from Queen's University of Belfast. And we hope to publish it soon. So to conclude, the incidence of cancer and cost of cancer burden has been increasing year by year. And therefore, effective preventive strategies and effective treatment methods are increasingly sought, and more importance should be put on primary prevention. Primary prevention should be considered a more cost-effective strategy to fight cancer, thanks to proper patient education and changing the modifiable cancer risk factor. The potential for primary prevention seems to hold promise. There is still lack of digital therapeutics intervention in the field of broadly understood prevention. And digital therapeutics may play a fundamental role in the shifting the problem from cancer diagnosis and treatment to prevention, and may be particularly suited to become the first line of defense in the area of prevention of oncological diseases, as well as other chronic diseases. So that would be the end of my presentation. Thank you all for attention.